Hello, everyone. Welcome to the Talks with the ARC Trust webinar series. My name is Sarah Geis, and I'm the Senior Director of Engagement for the ARC Master Trust, a program of the ARC of Indiana. We want to thank you all for watching our webinar series, and as a reminder, all of our webinars are recorded and made available on our website to view at any time. To see other webinars in our series, you can visit thearctrust.org and click on the Webinar and Videos button in the banner. In today's webinar, we will be talking about Medicaid patient liability. We'll review when liability is assessed, how it's calculated, and how it relates to special needs trusts. When people think about Medicaid covering nursing home costs, they usually assume that once in a nursing home facility, Medicaid will cover 100% of costs and expenses. This, unfortunately, is not the case in most circumstances. For individuals who are residing in Medicaid nursing homes, there is a cost that the individual is required to pay towards their care. This is known as patient liability. This is also sometimes referred to as share of cost, co-payments, or patient paid amounts. So in short, the Medicaid patient liability is the monthly amount that a patient is required to contribute towards their nursing home costs. How is patient liability calculated? The amount that a patient would be required to contribute is calculated and assigned by the local county office of the Division Family Resources Office. Patient liability is based on an individual's monthly income and allowable deductions and allowances. Income can include a person's Social Security benefit, pension, rental or farm income, or others. Deductions can include things like other health insurance premiums, spousal or dependent support, and others. In Indiana, everyone is allowed to keep $52 of their income each month. This is what's known as a personal needs allowance. So let's take a look at an example. To give you an example of how this could look, let's say we have an individual who is receiving $1,600 in Social Security as their income each month. They also have a $200 monthly pension. This means that their total income is $1,800 per month. They also have to pay Medicare premiums totaling $174.40 and have a personal needs allowance of $52. Their total deductions are $226.40. This means when we take the total income and subtract the total deductions, the individual's patient liability is what is remaining. So for this individual in this example, their patient liability that they would be required to pay is $1,573.60. At the ARC Master Trust, we are asked if a special needs trust can cover the patient liability costs for an individual. It can sometimes depend on the situation. One of the primary functions of a special needs trust is that it is supposed to supplement, not supplant, an individual's government benefits. If a special needs trust is paying for a person's patient liability, this could be viewed as the trust supplanting the purpose of the individual's income or Social Security benefit, since it's that person's income that is determining what the patient liability is. First and foremost, it is the responsibility of the trustee to make sure that the trust does not impact the trust beneficiary's eligibility for government benefits. This could mean that a special needs trust could be hesitant to pay for a person's patient liability. There could be exceptions, and if you are considering a special needs trust for yourself or helping someone establish a trust, it would be important to talk with the trustee or organization to see how they handle patient liability payments. Thank you all again for watching, and we hope that you've found this informative. If you have questions or would like to learn more, please feel welcome to visit us at our website, send us an email, or give us a call. You can also join us on social media to learn more.